Why panic attacks feel like you're dying, but you're not. Let's imagine someone named Jane. Jane is driving home from work on a Tuesday afternoon. She's thinking about what she's going to make for dinner. Maybe listening to the radio. Nothing unusual is happening. And then, out of nowhere, her heart starts pounding, her chest feels tight, her hands begin to tingle. She takes a deep breath, but it does not feel like enough air. Within seconds, her mind starts racing. Am I having a heart attack? Am I dying? Should I call 911? She looks around. Everyone else is driving like nothing is wrong. But inside her car, it feels like her world is falling apart. Eventually, the feeling passes. But she's left wondering, what just happened to me? If someone came into my office and told me Jane's story, the very first thing I'd want them to know is this. Jane isn't weak, she isn't going crazy, and she certainly isn't the only person this has happened to. As a psychiatric nurse practitioner, I've heard stories like Jane's many times. Panic attacks are one of the most frightening experiences a person can have because they don't just affect your thoughts, they affect your entire body. Today, I want to explain what is actually happening inside your brain and nervous system during a panic attack, because once you understand what's happening, they often become a little less frightening. So what is a panic attack? Let's go back to Jane for a minute. A few minutes ago, she was driving home. Nothing seemed wrong. There wasn't a bear in the road. No car was about to hit her. No one was chasing her. And yet, her body reacted as though she was in an immediate danger. That's what makes panic attacks so confusing. People often think, this all must be in my head, or I'm just anxious. But panic attacks are much more than worried thoughts. They're a very real response from your nervous system. When Jane's heart started racing, she didn't decide to make it race. When her breathing changed, she wasn't choosing to breathe difficult. When her hands started tingling, she wasn't imagining it. Her body was doing exactly what it was designed to do. It was preparing to survive. You may have heard of something called the flight or fight response. I've mentioned it here before in talking about anxiety. This is one of the oldest survival systems that we have. Thousands of years ago, if our ancestors suddenly came face to face with danger, their brains didn't stop to think. I wonder if that's a threat. They reacted immediately. Their heart pumped faster to get blood to their muscles. Their breathing sped up to bring in more oxygen. Their muscles became tense and ready to move. Their senses became sharper. All of these changes gave them a better chance of surviving. The amazing thing is, your brain has that exact same survival system today. The problem is, sometimes your brain activates it even when there isn't actual danger. To Jane's brain, something felt life-threatening. Not because it really was, but because her brain believed it might be. And once your brain believes you're in danger, it doesn't wait for permission, it pushes the panic button. That's why panic attacks often feel like they come out of nowhere. People will tell me, Robin, I was just sitting there, or nothing stressful was even happening. That's because panic attacks aren't always triggered by what's happening around you. They're triggered by what your brain believes is happening. And here's another thing that surprises people. The symptoms don't feel voluntary because they aren't. You don't choose to make your heart race. You don't decide to become dizzy. You don't intentionally make it hard to breathe. Your nervous system is responding automatically, trying to protect you. Unfortunately, it's protecting you from a danger that isn't actually there. And that's why panic attacks feel so sudden, so intense, and so incredibly difficult to control. The good news is, once you experience what's happening, the experience starts to make a lot more sense. Because before we can learn how to respond differently, we first have to understand what your brain is thinking. So let's talk about that next. So let's go back to Jane. Remember, she's still sitting in her car. Her heart is pounding. She can't catch her breath. She's convinced something terrible is happening. But here's what's actually happening inside her brain. It all starts with one thing: perceived danger. Notice I didn't say real danger, I said perceived danger. Because your brain doesn't react to reality, it reacts to what it believes is happening. Deep inside your brain is a small structure called the amygdala. Think of it as your brain's smoke detector. Its job isn't to think, its job is to protect you. If it believes you're in danger, it doesn't stop to ask questions. It pulls the fire alarm. The moment that happens, your brain activates your fight or flight response. And instantly, your adrenal glands release adrenaline into your bloodstream. And that's when your body begins to change. Very quickly, your heart will start beating faster because your brain wants to pump more oxygen-rich blood to the parts of your body that would help you escape danger. Your breathing becomes faster and shallower because your body is trying to bring in more oxygen. Blood flow shifts away from areas that aren't essential for immediate survival and toward your large muscles, the ones you use to run or defend yourself. You may start sweating because your body is trying to keep itself cool in case it needs to work hard. Your muscles tighten, which can cause shaking or trembling. As your breathing changes, you may feel dizzy, lightheaded, or like things around you don't feel quite real. Now remember, Jane doesn't know any of this is happening. All she knows is her heart is racing, her chest feels tight, she's dizzy, she's shaking. So what does her brain do next? It tries to explain those sensations. And almost instantly, it jumps to the worst possible conclusion. Something must be terribly wrong. I'm having a heart attack. I'm dying. I'm losing control. And here's the really important part. Those frightening thoughts aren't what started the panic attack. They happen because the body is already reacting. Those thoughts create even more fear, and more fear tells the brain, see, we really are in danger, which releases even more adrenaline, and now you've entered what we call the panic cycle. Once you understand that cycle, everything about panic attacks start making much more sense. And that's exactly what we're going to talk about next. So why panic attacks feel like a heart attack? So let's just imagine Jane is sitting in my office a week later. She looks at me and says, Robin, they told me it was a panic attack, but it felt exactly like a heart attack. And I completely understand why she feels that way, because panic attacks don't just create thoughts, they create physical symptoms. Let's talk about why. Chest pain. Jane's first question is, why did my chest hurt so much? Chest pain is one of the most frightening symptoms of a panic attack. During your body's emergency response, your heart begins to work harder, your chest muscles tighten, and your breathing changes. The muscles around your chest and ribs can become tense and sore. That tension can cause real pain, not imagined pain, real pain. The difference is that in a panic attack, the pain isn't usually caused by blocked blood flow to the heart. It's being caused by your body's alarm system going into overdrive. Shortness of breath. Well, then Jane asks, why couldn't I catch my breath? This surprises many people. During a panic attack, you're actually getting enough oxygen. The problem is that you're breathing faster than normal. That rapid breathing lowers the amount of carbon dioxide in your blood, and when that happens, it creates the sensation that you're not getting enough air. So even though your lungs are working, your brain tells you, breathe harder, which often makes the feeling even worse. Next, Jane asked me, why was my heart pounding so hard? That's adrenaline doing exactly what it was designed to do. If your brain believes you're in danger, it wants your muscles ready to move. The fastest way to do that is to pump more blood throughout your body. So your heart beats faster, not because it's failing, but because it's trying to protect you. And then Jane remembers, my fingers were tingling and my lips felt numb. Again, that's something we commonly see during panic attacks. When your breathing changes, the level of carbon dioxide in your blood changes too. That can affect your nerves. It can cause tingling or numbness in your hands, feet, or around your mouth. It's scary, but it's a normal physiological response to rapid breathing. Now, sweating. Jane says I wasn't even moving, so why was I sweating? That's because your brain thinks you're about to. Your body prepares to run, fight, or escape. Sweating is your body's way of cooling itself down, just in case you suddenly need all that energy. And then Jane says, I thought I was going to throw up. That happens because your digestive system isn't your brain's priority during an emergency. Blood flow shifts away from digestion and towards the muscles that you're using to survive. And as a result, your stomach often slows down. That's why nausea, butterflies, or an upset stomach are so common. Jane also remembers feeling lightheaded. Some people even feel like they're about to pass out. That dizziness is often related to changes in breathing and circulation during the panic response. Your brain interprets those sensations as danger, even though they're part of the body's normal survival response. One symptom that surprises almost everyone is feeling disconnected from yourself. Some people describe it as, I felt like I was watching myself, or everything around me suddenly felt unreal. When your brain is overwhelmed, it can temporarily change the way that you experience your surroundings. It's called depersonalization or derealization, and while it's frightening, it's a recognized symptom that can occur during a panic attack. And finally, Jane looks at me and says, Robin, I honestly thought I was dying. And I tell her, of course you did. Think about everything your body was experiencing. Your heart was racing, your chest hurt, you couldn't catch your breath, you were dizzy, your hands were tingling, you felt disconnected, your brain wasn't trying to scare you, it was trying to explain all of those sensations. And unfortunately, the first explanation that it came up with was the scariest one. This must be a heart attack. I must be dying. But here's what I want you to remember. Your symptoms are real. Your fear is real. But the conclusion your brain reached wasn't accurate. Your body wasn't failing. It was trying to protect you. And once you understand that, everything starts to make a little more sense. But here's where panic attacks become especially difficult. Once your brain believes you're in danger, it starts creating a cycle that feeds itself. If that's happened to you, I want you to hear this. If that happens to you, I want you to hear that you're not imagining it. Let's talk about why that happens. So let's go back to Jan one last time. She's driving home. Her heart starts racing. Her chest feels tight. She can't catch her breath. She feels dizzy. Immediately, her brain says something is terribly wrong. And here's where the panic cycle begins. It didn't actually start with fear. It starts with a body sensation. Maybe it's a skipped heartbeat. Maybe it's chest tightness. Maybe it's feeling lightheaded. Maybe it's simply noticing your heart beating a little faster. For most people, those sensations come and go. But an anxious brain pays very close attention to them. Instead of thinking, that's interesting, it thinks, what if something is seriously wrong? The moment your brain believes you're in danger, it sends out another burst of adrenaline. Now your heart beats even faster. Now your breathing becomes even quicker. You become even dizzier. Your muscles tighten even more. And now your brain notices all these new symptoms. So it says, see, I was right. Something really is wrong. And that thought creates even more fear. And more fear creates more adrenaline. More adrenaline creates more physical symptoms. And more symptoms convince your brain that the danger must be getting worse. Before long, you are caught in a cycle that feeds itself. It looks something like this. You notice a sensation. Your brain interprets that sensation as danger. Your body releases more adrenaline. The symptoms become stronger. Your brain becomes even more convinced you're in danger. The cycle repeats, and this is why panic attacks can feel like they keep building. Not because your body is failing, but because your brain is trying harder and harder to protect you from a threat that isn't actually there. One of the biggest turning points for many of my patients happen when they realize something very important. The symptoms aren't causing the panic, it's the meaning they're giving those symptoms. Think about it this way. Imagine your heart beats a little faster because you walked up a flight of stairs. Most people think, I walked upstairs. Now imagine your heart beats faster while you're sitting quietly on the couch. An anxious brain thinks, why is my heart racing? What if it's my heart? What if something's wrong? Same symptom, very different interpretation. And that interpretation changes everything. Because once your brain feels the sensation as dangerous, it keeps pressing the alarm button. The good news is once you understand this cycle, you don't have to believe every alarm your brain sends. You can begin responding differently. And that's exactly what we're going to talk about next. One sentence changed the way many of my patients think about panic attacks. Your brain isn't reacting because you're dying. Your brain is reacting because your brain believes you are. Your body isn't reacting because you're dying. Your body is reacting because your brain believes you are. So at this point, Jane asked me a question that almost everyone asks. Robin, what caused this? And the honest answer is, sometimes we know and sometimes we don't. One of the biggest myths about panic attacks is there always has to be a major stressful event. Sometimes there is, but many times there isn't. Let's talk about some of the more common triggers. For most people, it's stress. Maybe they've been juggling work, taking care of a family, not sleeping well, trying to keep everything together. Sometimes the body absorbs stress long before the mind realizes just how overwhelmed it's become. For other people, it's caffeine, that extra cup of coffee, an energy drink, or even a pre-workout supplement. Caffeine speeds up your heart and stimulates your nervous system. If your brain is already on high alert, that physical sensation can sometimes become the spark that starts the panic cycle. Then there's sleep. I can't tell you how many patients have said, Robin, everything got worse after I stopped sleeping. Sleep deprivation makes it harder for your brain to regulate emotions, stress, and fear. It's turning up the sensations on your brain's alarm system. Trauma also plays a role. Sometimes a panic attack develops after experiencing something frightening or overwhelming. Your brain learns, I need to stay alert so this never happens to me again. The problem is, sometimes it becomes alert all the time. For other people, the trigger isn't danger itself, it's the fear of danger. This is especially common in healthy anxiety. Maybe your heart skips a beat. Maybe you notice a headache. Maybe you feel a little dizzy. Most people move on with their day, but an anxious brain starts asking, what if it's something serious? And that thought alone can trigger the body's emergency response. Then there are very specific situations. Some people only panic while driving, others in crowded stores, on airplanes, in elevators, standing in long lines, or even while sitting in church. Over time, the brain starts connecting those places with fear. Eventually, just walking into that situation can activate the alarm system before anything has even happened. And finally, sometimes there doesn't seem to be a trigger at all. People tell me, Robin, I was watching television, I was eating dinner, I woke up from a sound sleep, and that's absolutely possible. Remember, your brain doesn't always react to what's happening around you. Sometimes it reacts to changes happening inside your body. Sometimes to stress that's been building for weeks. And sometimes the reason isn't immediately obvious. That can be frustrating. But it doesn't mean you're losing your mind. It means your nervous system has become very sensitive to detecting danger. And here's the good news. Once we identify your trigger, or even recognize the patterns, we can start teaching your brain those sensations aren't actually dangerous. And that's where recovery begins. So now we understand what panic attacks are, why they happen, and what can trigger them. And the next question becomes what actually helps. Because despite how frightening panic attacks feel, there are things we can actually do that really make a difference. So now we understand what's happening. Let's talk about the question everyone wants answered. Robin, what do I do when a panic attack happens? The first thing I want to tell you is probably not what you're expecting. The answer is not just calm down. If you've ever heard someone say that to you, you probably wanted to respond, if I could calm down, don't you think I would? The truth is, when you're in the middle of a panic attack, your thinking brain isn't in charge. Your survival brain is. So instead of trying to argue with your brain, we need to help your nervous system realize I'm actually safe. So let's talk about what can help. Slow your breathing. Remember when we talked about breathing? During a panic attack, most people begin breathing faster without even realizing it. The rapid breathing can make dizziness, tingling, and chest discomfort even worse. One of the most helpful things you can do is slow your breathing. Not by taking huge gasping breaths, but by taking slow, gentle, controlled breaths. You're not trying to force yourself to relax. You're giving your nervous system the opportunity to settle. Ground yourself. Next, ground yourself in the present moment. When panic takes over, your brain is completely focused on danger. Grounding helps remind your brain where you actually are. Notice what you can see, what you can hear, what you can feel. Maybe it's your feet on the floor, the chair supporting your body, the sound of the air conditioner. You're gently reminding your nervous system, I'm here and I'm safe. Let the wave pass. One of the hardest things to do is also one of the most helpful. Let the wave pass. Panic attacks are incredibly uncomfortable, but they don't last forever. Imagine standing in the ocean. When a wave comes, you don't stop it. You let it rise, roll over you, and eventually it fades. Panic works much the same way. The more we fight it, the bigger it often feels. Reduce avoidance. Here's something that surprises many people. Avoiding everything that causes a panic often keeps the panic alive. If Jane had a panic attack while driving, her brain quickly learns driving is dangerous, so she stops driving. For a little while, that feels better. But what did her brain learn? Avoiding driving kept me safe, and now the fear gets even stronger. Sometimes recovery means slowly teaching your brain that the place that you feared was never actually dangerous. This is often done gradually with the support of a therapist. Therapy can be incredibly effective for panic attacks, especially approaches like cognitive behavioral therapy or CBT. One of the goals of therapy isn't simply to stop panic, it's to change the way that you respond to it. Because once your brain starts interpreting every physical sensation as a catastrophe, the panic cycle begins to weaken. And then there's medication. For some people, medication can also be an important part of treatment, not because medication changes who you are, but because it can help reduce the intensity or the frequency of panic symptoms while you're learning new coping skills. Medication isn't the right choice for everyone, but for some people, it can be life-changing. That's a conversation to have with your healthcare provider after a thorough evaluation. And finally, I want to talk to you about something that's incredibly powerful: education. Understanding, knowing what's happening inside your body. I can't tell you how many patients have said, Robin, just knowing what was happening made the next panic attack a little less scary. Why? Because instead of thinking, I'm dying, they begin thinking, this is my nervous system. I've been here before. This feels awful, but I know what's happening. That shift doesn't make panic disappear overnight, but it changes your relationship with it. And sometimes that's where healing begins. Which brings me to the most important question I ask my patients, not how do I stop panic, but something entirely different. Let's talk about that next. So before we finish, there's something I want to be very clear about. Just because panic attacks can cause chest pain does not mean you should assume every episode of chest pain is anxiety. As a psychiatric nurse practitioner, I never want someone ignoring symptoms that could represent a medical emergency. If you're experiencing chest pain for the first time, if your symptoms are severe, if they feel different than anything you've experienced before, or if you think you might be having a heart attack or another medical emergency, please seek immediate medical evaluation. Your health and your safety always come first. Now, let's imagine Jane went to the emergency room. The doctors examined her. They checked her heart. They ruled out a heart attack and other serious medical conditions. That information is actually very important because once medical causes have been ruled out, we can begin asking a different question. If this wasn't my heart, what was my body trying to tell me? For many people, that's the moment everything begins to change. Instead of living in a constant fear that the next episode will be fatal, they begin to understand what's happening inside their nervous system. And that understanding changes everything. It doesn't mean panic attacks suddenly disappear, but it does mean they become much less mysterious. Instead of thinking, I'm dying, you begin thinking, I've been evaluated. I know what's happening. This is frightening, but it isn't dangerous. That shift is incredibly powerful because fear grows in uncertainty. Understanding helps take uncertainty away. And once you've ruled out a medical condition, you and your healthcare provider can begin focus on treating what is actually happening, not just surviving it, but understanding it. Which brings me to the question I think changes everything. And it's not, how do I stop panic attacks? It's something much more important. Let's talk about that. So let's finish Jane's story. A few months later, Jane comes to see me. She smiled and said, Robin, I still remember my first panic attack because it doesn't control my life anymore. That doesn't mean she never feels anxious. It doesn't mean she's never had a bad day. What changed wasn't that she became fearless. What changed was that she finally understood what her brain had been trying to do, and understanding replaced some of the fear. If someone came into my office today and asked me, Robin, will I always have panic attacks? I would tell them no. Panic attacks are treatable. Many people recover. Many people go months, even years without another panic attack. And even if they do have another one, they're no longer convinced they're dying. They're able to recognize what's happening and respond differently. I also want you to remember something. Having a panic attack doesn't mean you're weak. It doesn't mean you're crazy. It doesn't mean you're losing your mind. And it certainly doesn't mean you're broken. It means your brain's alarm system became a little too sensitive. It was trying to protect you, even though there wasn't real danger. The good news is our brains can learn. Just as your brain learned to sound the alarm, it can also learn when it's safe to turn the alarm off. That doesn't happen overnight. It doesn't happen perfectly, but with the right treatment, the right support, and the right understanding, it absolutely can happen. And I hope that's what you take away from today's video. Not that panic attacks aren't scary, because they are. They're treatable, and you don't have to face them alone. If you've ever experienced a panic attack, I'd love to hear your story. What did it feel like before you knew what it was? Or, if you're comfortable sharing, what was the moment you realized this isn't a heart attack? Reading your experiences may help someone else realize they're not alone. If this video helped you to better understand panic attacks, I'd really appreciate it if you'd like this video, subscribe to the channel, and share it with somebody who may need to hear it. Next week, we're going to talk about healthy anxiety, why our brains sometimes become convinced that every symptom means something serious, and how that fear becomes a cycle that's very difficult to break. If you don't want to miss it, make sure you're subscribed. And if you live in North Carolina and you're looking for a comprehensive psychiatric evaluation or ongoing mental health treatment, you can learn more about my practice by visiting the link below. And remember, the right treatment starts with the right diagnosis, and the right diagnosis starts with the right questions. Until next time, Be kind to your mind.